Hello and welcome back to my channel. If you are new here, hello, welcome to my channel. My name is Lanice. I'm a nurse and I do these cool little nursing videos. If you are not new here, hello, thank you for tuning in to another video. You already know what I'm going to say. Thank you for tuning into one of my videos because you could be anywhere in the world, but you are here with me, baby. And that's greatly appreciated. Whew. All right, so on the last video, I got several comments, good and bad, but one of the main comments that I did get from some of my friends and some of my watchers or viewers, excuse me, is that the mic picks up on every gasp that every gasp of air that I breathe. And I honestly, this is not my mic. Someone was nice enough to loan it to me for a brief time, and I don't know how to change that, y'all. So if it's that bad, I don't know what to do, because when I get excited and when I talk fast, I tend to breathe heavily. I'm in great shape. I work out a lot. I run a lot. So I don't know why I breathe like that, but whew, just bear with me. Maybe if I talk a little bit slower, it won't be as noticeable, but I really don't know what to do about it. So I do apologize. I just ask that you bear with me until we find a solution to that. But other than that, I think the last video did pretty well. I think that you guys really enjoyed the content. So we're here for another one. All right. So today's video, we're going to talk about why you should never, ever, ever date a nurse. I'm just kidding. I will never, ever tell you guys never to date a nurse. First of all, let me tell y'all, dating as a nurse is super hard, because when you tell someone you're a nurse, you get like one of two comments like, oh, so when I'm sick, you'll nurse me back to life. No, I won't. Actually, when men get sick, you guys are babies. You have a cold, blow your nose and go sit down somewhere. Or you get, oh, you got some money. Ooh, you got the big bucks. First of all, why are you worried about how much I make? And second of all, I don't like spending my money, so why do you think I'm going to spend it on you? And third of all, no, I don't make the big bucks. Like we do not make as much as people think we make. So no, that's not right, sir. That is not right. Okay, so whenever I'm dating, when people ask me what I do, I'm like, I work in the hospital. I work in the hospital. Like I have grown to hate telling men that I'm a nurse, because the reaction it's so cliche. Like, you guys are so like cliche. You have absolutely no je ne sais quoi. I don't even know if that fits. I just always wanted to use that word. But it's like, you guys like, it's no thought. Like, you guys all say the same thing. You guys like, you're typical males. But anyways, today we will talk about like the pros and cons of dating a nurse, because I am a nurse and I'm single for the most part. And I will say that nursing in the area that I live is very common. It's a very common practice. It's a very common career for a lot of women, Black and white, Hispanic, Asian, whatever. It's a lot of nursing because I live in a large city, and because we're very big on medicine around here. There are like a few medical schools. We have a large hospital system here in Charlotte. So the nursing is a very, very big career whenever it comes to women. So I see that every time I date a guy or go on a date with a guy, they're like, oh, what is it about you nurses? I date a lot of nurses. Don't nobody want to hear that, first of all. We don't want to hear that. But yeah, so it's a lot of nurses out here that are single and they are dating, and we're going to go over the pros and cons of what it is like to date a nurse. So if you know me, you know I like the bad news first. So we're going to go with the cons of dating a nurse. And I would say the one that sticks out the most, of course, is the irregular hours. The irregular hours. Like, people always talk about, oh, you're a nurse, you only work 3 days a week. First of all, I work 5. Because your girl got 2 jobs. And you would know that if you watched my last video. And if you haven't watched my last video, please go back and check it out. But the irregular hours, even if you only work 3 days a week, those 3 12-hour shifts are a burden, okay? They are a burden. So the irregular hours can make it hard to date someone, because a lot of jobs require you to work every other weekend, when most people work Monday through Friday. They have the weekends off. So you want to go on a date with someone, you might end up going on a date with someone on a Thursday night as opposed to a Saturday night, because you might have to work the next 2 or 3 Saturdays, depending on how you set your schedule up. And then working 12-hour shifts, if you work them back to back to back, that 4th day, you don't want to be bothered. I do not want to be bothered with anyone after I work 3 12-hour shifts in a row. Yes, it is convenient when you only have to work 3 days a week to be considered full-time, but I'm telling you, those other 4 days a week are those other 4 days a week are spent recuperating. So the irregular hours does make it pretty hard to date. I would say that another con to dating a nurse is that it is a very high stress. It's a very high stress career. You see a lot of people dying. You just naturally have to take care of people on a day-to-day basis, depending on what type of nurse you are. But I will say that no matter what field of nursing you're in, I always hear that it is a very high stress job. Let me try to move this mic away a little bit. I'm looking at the sounds on the camera, and it is like really picking up, like it's like to the max. So I'm afraid that the sound might not be it might be like way too loud. But anyways, we'll figure it out. Anyways, so nursing is a very high stress job. So when I go to work, I don't really want to do too much talking on when I get off work. I'm not even gonna say that because sometimes I have a long drive home and I catch myself talking on the phone all the time. But it's just a very high stress job. So I see or I hear that a lot of nurses complain, and guys do not like to hear women complaining, but I hear that a lot of nurses, all they do is complain, because I mean, the job is stressful. Like if you had to do what we do, you would probably complain too. Don't get me wrong, super grateful for my career, super grateful for my job, but the job is high stress, okay? All right, so that leads to point number 3, which would be the emotional toll. Watching people pass away, seeing people not necessarily get nursed to health, but maybe get nursed to death, or people who just don't get better, or even just seeing people who have reoccurring visits to the hospital. You know, all of that plays an emotional toll on a person. And when you carry that burden, if you're a naturally empathetic person and you carry other people's burdens on you, that can be very hard on you emotionally. And when you're interacting with other people, sometimes that can kind of wear off onto your other relationships. I will also say that I can be a hypochondriac, and I totally blame that on me being a nurse, because anytime something is wrong, whether I have a little sniffle or a little itch or a little pull or something, I'm like, yo, something's wrong with me. And that can play an emotional toll. That can take an emotional toll on people too, because it's like, girl, you know about all these illnesses and all these all this pathophysiology and blah 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 blah, and you think everything you always think you have cancer. Like you always think you have cancer because every sign and symptom, like you know everything about the body almost. So that can be irritating to some people too, because I feel like people are like, Lanice, there's nothing wrong with you, but I'm like, yes it is. And it's only because I'm a nurse, and I know that pain and it just all equals up to something. Like that's your body's way of telling you that something isn't right. And so maybe I put a little bit more emphasis on it than need to be sometimes, and that can take an emotional toll on the people around me. So yeah, the next point I would say, or the next con, would tie into the first one, and it will be the fact that I have very little free time. Very little free time. If you have a nurse that's very active, she might be going to school. She may be in professional groups like the American Nursing Association or the Black Nurses Association, someone that takes their career very seriously as a nurse, they're not going to have a lot of time for you. And some guys like that. Some guys like the fact that their woman is always busy, but some guys are like, yo, you're way too busy for me. This is not healthy. Like I need some time. And that can not only make it hard when it comes to dating, it can make it hard when it comes to raising a family. It can make it hard when it comes to being a parent, being a daughter, being a sister, being a cousin, being a friend. That limited amount of time, it's definitely a con whenever it comes to dating a nurse or being a nurse or whatever. So yeah. So kind of piggybacking off on the emotional toll that it may take on a relationship, I would say emotional burnout. Like sometimes I catch myself, even with my daughter, I can be like a little emotionally unavailable because it's like, I see sick people, I deal with emergencies all the time. And so whenever I'm at home, like when I'm around like my friends and stuff, I don't want to deal with the BS. Like I don't want to deal with anything that requires me to have any type of emotion, because I have to put so much emotion into work. Like emotionally, I'm burnt out. Emotionally, I'm unavailable. Like I want to be happy. I want to be around people that are laughing. I don't want to deal with any type of negative emotion, because I'm dealing with that all day at work. I am not only someone's nurse, I'm not only someone's medication administrator, I am people's therapists at work, all day at work. I go in and out of patients' rooms, and not only am I listening to their problems, I'm listening to their families' problems. I'm listening to my coworkers' problems. I'm listening to the problems that my manager may have with me. Like, it's all day long, I'm dealing with problems. So when I'm at home, or when I'm with my friends, or when I'm dating someone, I don't have the emotional capacity to deal with your problems. I am emotionally burnt out. Okay. So I would say that is definitely a con to dating a nurse. So we will move into the pros, because that literally kind of just burnt me out emotionally just even talking about it. So we'll go ahead and get into the good stuff. Okay. So one of the pros of dating a nurse, I would say, is the communication. Yeah, girls, nurses' communication is top tier. Okay. I don't care what anyone says. Nurses can communicate better than anybody else. Okay. We have to communicate all day long. We have to talk about feelings all day long. So I know how to talk. I know how to communicate with people. I will tell you when something's good. I will tell you when something's bad. I will tell you what I like. I will tell you what I don't like. I have no problem communicating. I have no problem, and not even just emotional communication whenever it comes to dating and family life, but I never meet a stranger. Like, I have no problem speaking to people I don't know, because I have to speak to people I don't know every day. I meet someone new every day that I go to work, whether it's a new patient, a new family member, a new coworker, a new work employee of the hospital. Every day I have to make conversation with people that I don't know. So my communication skills are top tier. Okay. Hence the reason I'm on this YouTube channel. All right. And of course, I hate to brag on myself, but the medical knowledge, a pro of dating a nurse is the medical knowledge. I'm going to be able to tell you if you just pulled something, or if you really need to go to the hospital because maybe that thing is broken, that part of your body is broken. I can tell if you have signs and symptoms of certain things that you just can't put your finger on. I will probably have a disease ready to tell you about. Okay. My medical knowledge, no, I'm not a physician, but I may as well be, you know what I mean? Because sometimes I have to do their job too. Okay. The medical knowledge that comes with dating a nurse is top tier. Who would not want to know what is wrong with them all the time? Who? Just tell me who, So that would definitely be pro number 2 of dating a nurse. Now, sometimes this can be a gift and a curse, but the work ethic that you have to be a nurse is also top tier. Okay. So the third pro to dating a nurse would be their work ethic. Even lazy nurses are not lazy. Okay. Even if you are a lazy nurse, if you go and do someone else's job or going into another career field, I'm almost positive that you will not be considered lazy, because you have to be a hard worker, especially if you are a bedside nurse. You have to be a hard worker in order to make it as a nurse. So I would think that the work ethic that it takes to work these long shifts, to work multiple shifts, to work overtime, to put food on the table for the babies, I would say that is a pro. Who does not want a hard working woman? I know we're all in our soft girl era, and don't get me wrong, your girl loves to be catered to, loves to be taken care of, loves when men pays for things, but your girl can also work hard. Okay. Your girl can also make her own money. Okay. And I would say what man doesn't like a woman with her own money, unless he's controlling and wants to control her, and doesn't want her to be able to leave him anytime she needed to, because she can't take care of herself or something, because she can take care of herself. That would be the only reason that I would think a man wouldn't want a hard working woman, outside of the fact that she might not have much time for him. Okay. So the work ethic that nurses have, along with the communication skills and the medical knowledge, chef's kiss. I think the pros already outweigh the cons. All right. Now, number 4 would definitely, and I'm sorry, I really cannot help the breathing. I'm so excited. I love recording for you guys. So, if I'm taking deep breaths, I apologize. Y'all just work with me. I'm going to learn how to stop. But number 5 on the pros list would be the adaptability. On a day-to-day working in the hospital, I have to be so flexible. It makes absolutely no sense. That sometimes I think it may have partly turned me into a yes man because I just don't care. Like, you want to do this? Sure. I don't care. Plans change? Fine. I don't care, because all day long I have to be flexible at the hospital. Oh, it's not my turn to get a new patient, but someone else is having a high stress day and all their patients are, much higher acuity than mine. Can you take a new patient, Lanice? Yeah, sure. I don't care. I have to be flexible all day, and that trickles into my everyday life with my friends and my family and the guys that I'm seeing. I'm not seeing multiple guys, but I'm just saying, if I were, I would know how to be flexible with all of them, okay? Because that is just, it trickles into your everyday life. Like, that is just how it is. Like, you have to be flexible as a nurse. So that would definitely be a pro. And of course, the one that we were all waiting for, the financial stability. If you want a woman or man, we have a lot of male nurses nowadays. If you want someone that you can build a family with, someone that you can build a future with, someone that is going to be financially responsible and can bring their own to the table. I know that's guys' favorite thing to ask nowadays. All the Kevin Samuelites out there love to ask a woman what they can bring to the table. But baby, if you're dating a nurse, she can bring just about everything you can bring to the table, okay? When it comes to finances, nurses can very much control how much money they make. You want to make a lot of money this month? I'll pick up a couple extra shifts. I'll pick up another job. You want to go on vacation next month? No problem. We can do that, because the financial stability that comes with nursing, it speaks for itself. This is one of the career fields where if you want to make extra money, it is always going to be available. I have never worked a job that would not allow you to pick up overtime. I have never worked a job that didn't need extra help on the weekends. I have never had a problem finding another job if I lost a job, because there's job security and financial stability whenever it comes to nursing. So no, I don't like when men are like, oh, you make the big bucks. Ooh, you got it. No, I don't like to hear a man say that. But at the end of the day, they're telling the truth. They're telling the truth. At the end of the day, like, nurses have the type of financial stability and job security that a lot of people do not have out here, especially in the economy that we live in. People are searching for jobs every day. I have a friend that has been without a job for quite some time now, to the point where he's applying at Target and Harris Teeter, and he's overqualified for those jobs, but he's underqualified for the jobs that he's been working. He's been without a job for quite some time now. That is not a problem you will have as a nurse, baby. And so, of course, that would definitely be a pro whenever it comes to dating a nurse. Honestly, y'all, that's all I got for you. That is all I got for you. If you have not already liked the video, please go and like it. If you haven't already subscribed to my channel, please go ahead and subscribe. And I just ask that you hit the bell notification, so when I post new videos, you guys will be notified. And I just ask that you share this, because we are trying to build community here, okay? We're trying to get all the people that are nurses, that want to be nurses, that are thinking about becoming a nurse. We need all the subscribers, baby. We need all the subscribers. But sorry I rushed through that. My camera's kind of going dead, and no, I'm being funny. But I rushed through it. I can't help it. I talk fast, and we're working on this YouTube thing. We're trying to get better at it. So that's really all I got for you guys. Again, if you forgot my name, which I doubt you did, but if you did, my name is Lanice. I'm a nurse. I make these cool little nursing videos, and I am out. Peace.